Cardiac arrest. It's a phrase that sends chills down your spine, and for good reason. It can strike anyone, anywhere, at any time. 1 minute life is normal, the next it hangs precariously in the balance. Imagine this, you're going about your day when suddenly someone collapses. They're unresponsive, not breathing, their heart seemingly silent. This is the stark reality of cardiac arrest. A sudden and often unexpected event that requires immediate action. Time is the most critical factor in these situations. For every minute that passes without CPR and defibrillation, the chances of survival plummet drastically. But there is hope. Knowing what to do in those crucial moments can be the difference between life and death. It's about empowering yourself with the knowledge and skills to act swiftly and confidently, potentially saving a life. While the terms cardiac arrest and heart attack are often used interchangeably, they represent distinct medical emergencies. Understanding the difference is crucial for providing appropriate care. Think of a heart attack as a plumbing issue. It occurs when blood flow to the heart muscle is blocked, often due to a clot in a coronary artery. This blockage damages the heart muscle but doesn't necessarily stop the heart from beating altogether. Cardiac arrest, on the other hand, is an electrical problem. It's like a sudden power outage in the heart. When cardiac arrest occurs, the heart's electrical system malfunctions, causing the heart to stop beating effectively. This abrupt cessation of blood flow to the body leads to a loss of consciousness and the absence of breathing. Without immediate intervention, cardiac arrest is fatal. Imagine a clock ticking relentlessly, each tick representing a diminishing chance of survival. This is the urgency of cardiac arrest. Statistics paint a stark picture. Less than 10% of people who experience cardiac arrest outside of a hospital setting survive. However, this grim reality can be dramatically altered with swift action. CPR, when performed immediately, can double or even triple a person's chances of survival. CPR, or cardiopulmonary resuscitation, involves chest compressions and rescue breaths. These actions help circulate oxygenated blood to the brain and other vital organs, buying precious time until medical professionals arrive. Equally important is the use of an AED, or automated external defibrillator. These portable devices can deliver an electric shock to the heart, potentially restoring a normal rhythm. Section 4. Your hands, their lifeline, a step-by-step guide to CPR. Learning CPR is not just for medical professionals, it's a skill everyone should possess. Remember, you don't need formal training to save a life. Follow these steps. First, check for responsiveness. Gently tap the person's shoulder and shout, "Are you okay?" If there's no response, they're unresponsive. Next, call for help. Immediately call 911 or your local emergency number. If you're not alone, ask someone else to make the call while you begin CPR. Then start chest compressions. Place one hand on top of the other, interlacing your fingers, and position the heel of your hand in the center of the person's chest. Push down hard and fast, aiming for a rate of 100 to 120 compressions per minute. Finally, continue compressions. Don't stop compressions until help arrives or the person shows signs of life, such as breathing or movement. Section 5. Technology to the rescue. Understanding and using AEDs. AEDs are becoming increasingly common in public places, and for good reason. These devices are designed to be used by anyone, regardless of their medical background. AEDs analyze the heart's rhythm and deliver an electric shock if needed, potentially restoring a normal heartbeat. Here's a simplified guide on how to use an AED. First, turn on the AED. Most AEDs have a simple on-off button. Once turned on, the device will provide voice prompts to guide you. Next, attach the pads. The AED will come with sticky pads or electrodes that need to be placed on the person's bare chest. Follow the diagrams on the pads and the AED for correct placement. Then, analyze the heart rhythm. Once the pads are attached, the AED will analyze the person's heart rhythm. Make sure no one is touching the person during this time. If advised, deliver a shock. If the AED determines that a shock is needed, it will provide clear instructions. Stand clear of the person when the shock is delivered. After the shock, resume CPR. Immediately resume CPR, starting with chest compressions. Continue following the AED's prompts. Section 6. Be the difference. The power of bystander intervention. In the face of cardiac arrest, bystanders are often hesitant to act, fearing they might do something wrong. It's important to remember that any attempt at CPR is better than none at all. Your actions, no matter how small they may seem, can have a profound impact. By stepping in and providing CPR and using an AED, you become a vital link in the chain of survival. Remember, you don't need to be a medical professional to save a life. By familiarizing yourself with CPR and AEDs, you empower yourself to act confidently in an emergency. Section 7. Knowledge is power, empowering yourself and your community. Cardiac arrest is a daunting reality, but it's a reality that we can confront head-on. Knowledge is power, and by understanding the basics of cardiac arrest, CPR and AEDs, we equip ourselves to make a difference. Encourage your family, friends, and colleagues to learn CPR and become familiar with AEDs. Advocate for AEDs to be readily available in your workplace, community centers, and other public gathering places. By fostering a culture of preparedness, we create a safety net that can potentially save countless lives. Remember, cardiac arrest doesn't discriminate, but our response can make all the difference.